It is now my pleasure and honor to introduce to you one of the center's strongest advocates, Dr. Dennis Charney, the Ann and Joel Ehrenkranz Dean of the Icahn School of Medicine at Mount Sinai. Dennis?
Thank you, Jim. And good morning, everybody. Let me add my thanks to all of you for being here to celebrate the critical work that the Mount Sinai Adolescent Health Center does and those legends who have made this work possible. Before continuing, I'd like to add my sincere thanks to the breakfast co-chairs who have made today's event possible. Lauren Cope Arnold and Joseph McGeehan. You can thank everybody. Rachel Moranis and Gregory Rubin. Claudia and Nelson Peltz. And Michael Yaker. Thank you, co-chairs. As Jim did, I also want to add my congratulations to today's honorees. As you will hear throughout today's event, this year's honorees are truly exceptional. They're inspirational and have shown their dedication to both the center and New York City's youth many times over. The Mount Sinai Adolescent Health Center was founded in 1968 by Joan Morgenthau. And today, her daughters and her niece are here today to help us celebrate. Thank you very much to the Morgenthau family. So it's been 55 years of innovation, and as we say at Mount Sinai, always finding a way. The specific challenges of adolescents and young adults what they face now has changed in many ways over the last 55 years. But the center's model of care for those adolescents and young adults is just as groundbreaking now as it was 55 years ago. Today, it is the gold standard for the world for the kind of care delivered to adolescents and young adults, and it's emulated around the world. This is in part because the center understands that adolescents and young adults need their own dedicated care that is exclusively to them and designed for their unique needs and development stage in mind. What's unique about the center is that it continually evolves in response to the challenges that young people face today. And in fact, and you all know this, as a result of the pandemic and issues related to addiction, that today's youth face a mental health crisis. We are seeing that in the wake of the pandemic, but also in other areas related to addiction. I'm a psychiatrist, and I focus on resilience and depression and anxiety, and this issue is top of mind for me. While the peak of COVID-19 may feel like the distant past for many of us, for many of today's young people, they are still feeling the impact. And that includes missing proms and other events, virtual school, loneliness, which is a particular problem, and the death of loved ones. In response, the Mount Sinai Adolescent Health Center has made meeting young people's behavioral needs a high priority. It has expanded its mental health care and ensuring that our youth have a safe, welcoming space that they know that they can find support and care. After all, the health and resilience of our young people isn't a luxury for a strong society. It is a necessity. It is essential. The Mount Sinai Adolescent Health Center helps adolescents and young adults heal, and thrive, and make informed health decisions so that they can focus on their education and fulfill the promise of adolescence and young adulthood. The Adolescent Health Center does this by providing high quality, comprehensive, and that's particularly important, integrated, confidential, also very important, care to our adolescents and young adults, all under one roof, at no cost to the patients. This means that a young person can come to the center for a birth control prescription and leave having received a comprehensive physical exam, a counseling session with a therapist and a new pair of eyeglasses, all in one place. For almost 35 years, the Mount Sinai Adolescent Health Center has been led by Dr. Angela Diaz. As its director, but also most recently, Angela has been named Dean of Global Health, Social Justice, and Human Rights at our School of Medicine. Everyone who has met Angela knows that she is truly a special individual who has worked tirelessly on behalf of New York City's adolescents her entire career, and her impact is worldwide. I often say that the Mount Sinai Adolescent Health Center is a jewel in the Mount Sinai Health System in our School of Medicine. And if that's the case, then we have Angela, alongside her incredible staff, to be thankful for the cutting and polishing of that jewel so it shines its brightest. A few months ago, and this may be news to some of you, Angela decided to step down as the director of the Adolescent Health Center, a position that she has held since 1989. We are currently conducting, with Angela's help, a national search for a new director. But it will be impossible to fill Angela's shoes. Personally, and I mean this from the heart, I have never met anyone with Angela's attributes: unmatched passion, kindness, resilience, commitment, and brilliance. I am honored to be her friend. And in fact, people think more of me because I'm her friend. Now, Angela is not leaving Mount Sinai. As Dean for Global Health and Social Justice and Human Rights at Mount Sinai, the world needs her more than ever. Angela's legacy is embedded in the DNA of the Adolescent Health Center. She was a patient there. But in addition, her children, who I believe two of them are here today, Gabrielle, a civil rights attorney in D.C., Adriana, a weekend anchor and national correspondent and former Asian national correspondent and former Asian correspondent for CBS News, I believe is here or will be here, and Daniela, a family medicine physician at Columbia. They were patients at the Adolescent Health Center. And don't be surprised if Angela's grandchildren, Isabella Rose and Xavier, will be as well. Now, this next paragraph is important. Now we are launching a $10 million campaign in support of the center, which we are going to name in Angela's honor. So it is going to be the Angela Diaz Adolescent Health Center forever. So not only is this a way to show our deep appreciation for all that Angela has done as a champion for adolescent health and young people throughout the world, it will ensure that the important work at the center will endure for future generations. It is my heartfelt hope that you will join us in this campaign so that the vital work of the Adolescent Health Center can expand and continue in perpetuity. So I can think of no better way to recognize Angela Diaz as the fierce advocate, and that fierce advocate it doesn't say it all, and leader that we know her to be, who has made such a profound impact on adolescents and young adults. Together, we can fortify Angela's vision to empower adolescents to thrive now and for years to come. Thank you, and it is my pleasure to welcome Angela Diaz to the stage.